Welcome to Ask Endocrinology channel. I'm Dr. Grace and with me is Dr. Hope. So,
Welcome.
yep, today we'll be talking about plant-based diet. This is the channel where we talk more about how to stay healthy, what are the things you need to know and needs to do, and in order to stay healthy, especially in relation to our hormones. So today we want to talk about the plant-based diet. What actually is plant-based diet, what it is, what are the benefits, and why should you try it? So Dr. Hope is going to tell us today about what exactly is this.
All right. So, what is a plant based diet? So, a plant based diet is a diet rich in plant based foods and low in animal based foods. So, what are some of the plant based foods? So, fruit and vegetables, obviously, green leafy vegetables, starchy vegetables like squash, corn, tomatoes, all types of fruit, but also nuts and seeds, peanuts, tree nuts, nut butters, seeds, and seed butters, as well as whole grains, refined and white breads and grains, cold and hot cereals, whole grain seeds, and pasta. So those are some of the examples of plant-based foods. It also includes tubers like potatoes, sweet potatoes, legumes, beans, chickpeas, lentils, and soybeans. So a plant-based diet is actually rich in those types of foods, but low in the animal-based foods. And what are some of these animal-based foods? Things like meat, obviously pork, chicken, turkey, fish, shellfish, and eggs. Um, and also low in dairy, milk, yogurt, and butter. So again, plant-based diets are diets that are rich in plant-based foods and low in animal-based foods.
That's good to know. So that means wherever you are, anywhere you are, if you go to your grocery stores or your marketplace to get food, focus more on getting the plant-based food, more in your plate when you eat than the meat. How
So
is this plant-based diet different from a Mediterranean diet or the so-called DASH diet?
Okay, so a Mediterranean diet is actually a subgroup of a plant based diet. So it is a type of plant based diet.
Okay.
The Mediterranean diet actually has its foundation in a plant based diet or in plant based foods. And according to Catherine McManus from the Harvard Health Publishing, the Mediterranean diet does have this plant based foundation, but also includes fish, poultry, eggs, cheese and yogurt a few times a week, with meats and sweets less often. So that is one of the differences.
About the vegetarian, how is vegetarian diet then differs from, or a vegan diet differ from this plant-based diet?
Okay, so a vegetarian diet is actually another subgroup of a plant based diet.
Okay.
But the vegetarian diet comes in many different forms. So, so there's the flexitarian diet, which includes eggs, dairy products, and occasionally meat, poultry, fish, and seafood. Again, this is quoted from Catherine McManus in the Harvard Health Publishing. The pescatarian diet, which is a different type of vegetarian diet, includes eggs, dairy foods, fish, and seafood, but no meat or
Hmm.
poultry. And then the vegetarian diet includes eggs and dairy foods, but no meat, poultry, fish, or seafood. And then finally, there's the vegan diet, which doesn't include any animal products, but is plant based.
Wow. So it seems the veggie or vegan and vegetarian, all those they have different subtypes.
Yes.
So it's best to just don't stress on what should I do or now, what is this definitions all about. Just focus on the plant the base being your base meal as your diet, and why we need to talk about this. Stay tuned.
Exactly. So, what are the benefits? What are the pros? Why should we even eat a plant based diet?
That's good. You know what research studies have said and have been done on people who eat plant-based diet as compared to people with everything on their plate. It's been shown that if you take plant-based diet, you have high tendency to control your weight very significantly. It's a very good way to live healthy lifestyle. And secondly, your blood pressure can be well controlled. Diabetes can improve significantly. Your cholesterol level can decrease significantly, and you have good normal cholesterol. All those metabolic syndrome or metabolic problem can significantly improve. So your general well-being becomes better, and you are able to live the way you want your life to be in terms of your health. So that's the big plus of this plant-based diet. Yes, it can decrease your risk of cancer. And not also that, as we age, we tend to have some kind of diverticulosis because our bowel movement slows down compared to when we were young. So it also helps prevent you from having diverticulosis. So it's a big plus, and it's a good
Wow.
thing to do. Yeah,
Well, I'm ready. I'm ready to start a plant based diet even now. So there are lots of great benefits.
there are
But
lots of
one
great.
thing, if that's right, one thing I would want to know though. So what are the cons? What are some of the negative aspects or cons
Mhm.
of having a plant based diet, or are there any? Can you tell us about those?
Yeah, sure. So there are many benefits of plant-based diet, as I've mentioned, but in terms of cons, because you don't take the animal proteins and the animal products, you have tendency to lose some micronutrients in your food. And these micronutrients includes the calcium, zinc, iron, and even omega 3. So majorly these are the cons, but it's more beneficial than disadvantage. And we've seen a lot of
Oh,
people on plant-based diet and their diabetes also improved significantly and even resolved. Yeah.
right. And as endocrinologists, we've actually seen it firsthand, right? We've seen the
Yes.
benefits of people who are using a plant based diet and the benefit it has on their blood sugar. So it definitely is, for us, it's something that is very significant for a disorder that we actually see often. So, for those of you who have diabetes, a plant based diet is very helpful in helping to control your blood sugars.
Yes. Yes.
Okay, so the take home points are: a plant based diet is a diet rich in plant based products, including fruits and vegetables, nuts, seeds, oils, whole grains, legumes, and beans, and low in animal products. Vegetarian and Mediterranean diets are subgroups with various variations of plant based diet as well. Some of the benefits of a plant based diet are weight loss, blood sugar control, heart disease, decreased risk of heart disease, and lowering the cholesterol, and blood pressure control as well. Some of the cons are that we can miss some of the nutrients, including zinc, iron, calcium. So definitely we would need to supplement with uh, multivitamins that contain those products so that we can make sure that we're not missing important basic nutrients. And but prior to starting a plant based diet, you should always consult with your doctor, especially if you have diseases, comorbid diseases like uh, diabetes or heart disease, just to work with your doctor in um, jointly starting this plant based diet or this change in your diet. So it's very important that you always consult your doctor when you're making a major change in your diet. Um, and that's it. So we really, encourage you to consider taking a plant based diet. Maybe it is the right thing for you, and you can really use uh, your wisdom in terms of how much of the the animal sources you want to include in that, because a plant-based diet that doesn't necessarily mean zero animal products. It just means limited amounts or low portions of animal products, but basically mostly plant-based.
Yes.
So
Yes.
thank you so much for joining us, and please remember to subscribe to our channel and stay tuned for different types of diets that we're going to talk about in the next few weeks, including the low carb and the keto diets, just to help us stay healthy, especially as we work together with also exercising. And again, just to remind you, I am exercising, working on my program for the marathon. I've finished 3 weeks of my second program, and I am going into my fourth week starting
Wow.
tomorrow,
That's
in
awesome.
preparing for this run.